Well, Dr. Bob Graboyes with Mercatus, thank you so much for joining us on this inaugural episode of Policy Gone Viral. We appreciate you taking some time under some rather unique circumstances to talk with us.
Yep. Well, welcome from here in Virginia, the Sunshine State.
Great, great. Well, we'll dive right in. In kind of the age of what we're kind of calling the COVID-19 pandemic, we're all kind of more aware now of healthcare regulations. And it seems like a lot of us are more cut the bureaucracy type libertarians now as we're trying to deal with all of this. First off, how did we get here to where we're at right
Oh, it's absolutely astounding. So I've been a healthcare researcher for 25 years. And honestly, I've seen more innovation in the last 25 days than I've seen in the rest of my career combined. Things that I've been advocating my whole career, that a lot of my writings revolve around, uh, at the state level, getting rid of certificate of need, broadening scope of practice for non-physicians, increasing use of telehealth, more back and forth across state lines for physicians. All that, I mean, everything is all happening at once, and plus at the federal level, loosening up the FDA, getting them to take care of things fast rather than in their usual slow ways, and that sort of thing. It's, and I think the way we got here is because there's a nasty virus that crossed the ocean. It's crossing America now. It's awfully dangerous. And aside from the health dangers, it has disrupted the American economy in a way that probably no event in American history has done.
And are these types of regulatory changes, have they, I mean, they've evolved over a span of decades that we're now, like you said, talking about, done more in 25 days and 25 years, but these regulations date back in some cases to the 70s or earlier, correct?
Oh, I would say they date back to the early 20th century. You can start with the predecessors of the FDA, the beginning of physician licensure. Um, the era of modern medicine begins around 1910, 1912, and they immediately began slapping on all sorts of uh, mostly well-intentioned regulations. It was the progressive era, and that was just the thing to do then. And they've been with us so long that we don't even realize they're not laws of physics.
Yeah, yeah. Well, let's talk a little bit about the Mercatus Center Healthcare Openness Project. It's really one of the best resources out there for states specifically that are looking to find where they can have some substantive impact. Tell us a little bit about the key points of the project and what your hope is for where it can be useful, especially now.
Sure. So if anyone wants to see it, it's mercatus.org/hope, HOAP, Healthcare Openness and Access Project. So what it is in its current iteration, we have just rushed several months early an emergency third edition of Hope, specifically to help legislators and regulators deal with the COVID crisis. But in the current iteration, it's 41 different variables. We call them indicators, grouped into 5 different categories, and then overall an overall Hope index. But well, everyone kind of has fun with the indexes and the rankings. I think the real substance is in looking at the variables and knowing which states are kind of freer in terms of letting hospitals build beds and ICUs and whatever when they want to, and which are kind of slow and require you to go through a long uh, regulatory process, which states are open and welcoming to telehealth and which states are not. And again, we have 41 different variables plus a couple of extra variables that we don't count in the indexes, but we call it the watch list, just things that
Right.
we're not sure how they really count, but they ought to be monitored.
Well, the most recent release, as you said, it was kind of rushed in advance because of the virus. It shows Florida actually fairly far down, and we have over the last year and a half passed a series of reforms here in the state dealing with things like our con laws, expanding telehealth, and some things even this year. I'm imagining Florida would be moving up in the rankings, but more important to that, and speaking to your point, what are some of the things that we should continue to be looking at as a state so that we can continue to make healthcare more accessible and more open in terms of access?
Sure. I know you've actually done quite a few reforms in the state that had that made it into the data. I mean, we sort of have to live with what data are available all at once
Sure,
for all the states.
sure.
And it just so happens that some of the data series predate an awful lot of the activity that Florida has done. But what you can do, and I don't have the numbers in front of me, nor do I have them memorized, but you can go to Hope, you can look at it. All the variables are rated 1 through 5, 1 being not very open, not very market oriented on that particular indicator, 5 being yes, open for business and innovation and whatever. Just look down the list, see which ones are 1s and 3s and 2s and whatever, and gives you a pretty quick summary of how you can sort of open up the health economy in Florida. Now, again, Florida has actually done quite a bit of that in just in the time since we received these data, and Florida and a lot of other states are just going at full throttle right now, changing these. So if we were to actually have updated data and be able to use it uh, let's say from a month or two now, my guess is the numbers would look awfully different. Now we will have a summer release that's more with that gets a stiffer review than this edition did. We sort of did not peer review this, and we did rush it and apologize if there are any flaws in it, but we thought it was important, given the crisis, to have the numbers in legislators' hands.
Definitely.
But I imagine Florida would be moving up already. Uh, and just from what I've seen, Florida is kind of in the mood to do well on these variables.
And this is one where I'm imagining that as states are looking to do things in a temporary setting that would address the factors of the virus and to kind of address supply issues or practitioner issues, you would kind of you would advise them to look at trying to do these things in a permanent manner because they would kind of address a lot of the healthcare issues long term, not just acutely with the virus, correct?
Oh yeah, I mean I've thought the states should do these things for quite a long time, um, and it's nice to see them doing it on the fly. And I hope that once they have suspended these regulations for a while, they will begin to think these actually work rather well. It's kind of nice if you need to add, for instance, and this is an immediate one, if we need to buy some ventilators or we need to set up an intensive care unit and add some beds, we don't have to get a report written up, take it to the state, wait for it to be considered. I don't know it's whether I hope it or whether I believe it, but I suspect a lot of these things are never going to go back to where they were just because the event itself is so traumatic.
Well, that kind of concludes what we were hoping to get from you this afternoon. Dr. Graboyes, I can't thank you enough for joining us. I look forward to following up as this kind of goes along, and maybe down the road we can kind of have a follow up to see what of the temporary reforms the states ended up making permanent.
Well, I've got some stuff written up. We can talk anytime you like, and for the foreseeable future, I'm not going anywhere. I'm going to be sitting right here on my deck.
Looks like none of us are. Thank you
Nope.
very much for joining us, and we'll see you soon.
You take care. Bye bye.
Take care. Make sure your comms folks and all of your public affairs folks are now that you should have had in the shot the whole time.
Well, I would have, but they acted pretty nice. They were quiet, which is not the usual thing for them.
Excellent. Well, appreciate it again. I'm sure we'll talk soon.